Okay, so this is a quick discussion on a feature of the body called Waldeyer's ring, described by Dr. Waldeyer back in the 1800s. It is a part of the lymphoid system whereby the bacteria that may try to enter the body through the oral cavity and even the nasal cavity can be thwarted by strategically positioned lymphoid structures. Now, very quickly, what we have here is the glossal surface of the tongue, which in itself, because of its villi, etc., can hold a fair amount of bacteria in its midst, sometimes giving rise to halitosis or bad breath. And the teeth, let's not forget that your teeth have spaces and recesses that are perfect nidus, perfect place for the bacteria to hide and survive for a long time. Now, of course, to prevent the blowback of these bacteria and seed infection deeper into the throat, we have Waldeyer's ring. So where would we position this Waldeyer's ring? Well, behind the anterior two-thirds of the tongue, which is, considered glossal surface, we have kind of a lumpy, bumpy area. So this is all nice and velvety, and it's used for gustatory sense. But behind it is this area that doesn't feel like the rest of the tongue surface. It is actually not a glossal surface. It is a lingual surface, and it does periodically cause irritation in a sore throat, for example, because it responds to a potential infection. The roof of the mouth is referred to as the palate, and the extension of the hard palate is a soft palate, and there's a muscle here called the tensor veli palatini under control of the vagus nerve, which then the muscle gives rise to a extension that comes down, which you know as the uvula of different lengths and sizes and shapes. The extension off of that palate is in the form of two long muscles that are covered by mucosa, and they create a couple of tonsillar arches. There's a anterior pillar associated with this arch in the front. We call them anterior tonsillar pillars, one on each side. And the muscle itself is called the palatoglossus. Palate, glossal surface. Posteriorly, however, we have the posterior tonsillar pillars, one on each side, and the muscle involved is the palatopharyngeus. Okay, so now we just have to put in the tonsillar structure that is found in the spaces. That's referred to as the palatine tonsil, one on each side. So let's give them their name. palatine tonsil. Again, one on each side. The space in which they reside are referred to as tonsillar fauces. Okay? Now, in addition, if one were to look superiorly and posteriorly past this point, you would be in the back of the nasal cavity. The back of the nasal cavity as the posterior or internal nares, also referred to as the choana for singular. And the choani have in their midst this other lymphoid structure, which is so discrete and organized, almost looks like a gland unto itself. And so the term adenoid has been used in the past. We also refer to it as the nasopharyngeal tonsil, one on each side. Okay? So there you have it. You have basically the beginnings of this ring-like structure. Like this, like that, and catching the lingual tonsil right here. So superiorly we have the adenoids, laterally we have the pharyngeal, palatine tonsils, and inferiorly we have the lingual tonsil. Now keep in mind that those are not the only lymphoid tissue involved in this arrangement of Waldeyer's ring. We have other areas of the eustachian tube that have lymphoid tissue associated with it. There's of course cervical lymph nodes that are sort of right in the area, just starting their drainage. They're associated with it. We have little patches of lymphoid tissue right in the pharyngeal mucosa, which are also associated with it. But in terms of kind of establishing that two-dimensional imaginary ring, well, that Waldeyer's ring would be what you see right here. Adenoid, so nasopharyngeal tonsil, the palatine tonsils, and the lingual tonsil. So I hope that helps in a better understanding of Waldeyer's ring.